It's lovely to see you on the show, Matthew. You're very welcome.
Thanks, Gloria.
You represent health bosses across the UK. You say you're extremely concerned about the widening ratio of staff to patients. What's the primary cause of that, and what's the primary impact of it on care?
So the short-term reasons for the situation that we're in, Gloria, are that we have a rising number of patients in hospital with COVID. Now, of course, the great news is that most of those patients are not as sick as the patients coming into hospital in wave 1 and wave 2. Although I think it's really important to emphasise that if you're not vaccinated, then Omicron can be as severe as the other variants that we've seen. So you've got those rising case numbers. The number of people in hospital with COVID has doubled over the last few weeks. And then, of course, staff themselves are, people like us, and they also get this virus. And if they've got it, they can't go into work, partly because they're not well, but also because, of course, they don't want to be spreading the virus within a hospital setting where there are vulnerable patients. It's worth also saying, Gloria, that we came into this crisis with an estimated 100,000 vacancies in the NHS. So the problems we've got now are on top of the fact that we don't have the full workforce that we need.
20 NHS trusts have now declared a critical incident. Just explain what that means, because the Prime Minister says it's not a good indicator of the pressure the health service is under.
No, actually, I think he's right about that, to the extent that what a critical incident represents is it represents a leader of a hospital basically saying, we're in a situation now where we need to ask all our staff to come forward. So often it will involve contacting staff who are on leave or rest days and asking them to come in because of the critical nature of things. And also it almost certainly means not being able to do other activities beyond those ones which are most urgent. So it might, for example, mean signalling that it's not possible to do non-urgent elective care. But the Prime Minister is right to the extent that it's something that leaders will do as a last resort. And actually the inclination of most NHS leaders that I speak to is to try to cope, not to draw attention to themselves. So this is really very much a last resort. And the pressures you'll see in those hospitals that have declared a critical incident are not really that different from the pressures that we experience, not just in hospitals, I want to emphasise, but across the health service as a whole. Because don't forget, we've also got a lot more COVID patients now out in the community. And that puts pressure on community services, mental health services and primary care.